We're being joined by two of the guests we had previously, Chad Masters with the Findlay, Ohio Health Department and Colleen Abrams with the Blanchard Valley Hospital. Chad, that was interesting what we just saw there, the Metro Laundry. The question came up, a lot of people must have this feeling. Okay, I can get it if somebody sneezes around me, that sort of mist, that vapor mist. But can I catch it from somebody's clothing if I work in a clothing store or I touch their clothing?
No, that's an inaccurate statement, and that's again why we try to get information out to the community, because of statements like that. What we want to focus on is making sure that hard surfaces are disinfected. We're not so concerned about porous surfaces such as clothing or towels or things of that nature, but we are concerned about making sure that there is proper disinfection being done on countertops, doorknobs, things like that, desks, work surfaces.
So if somebody sneezes into their elbow and you happen to touch their elbow, you're okay?
That's correct. And we obviously want to make sure that they're washing their hands
right.
After touching that. But essentially, that's what we're telling people to do if they have to sneeze or cough. Even now, cough into your elbow, into your shirt sleeve, because that way you're not going to be, if you sneeze into your hands, you go touch a doorknob or the tabletop, you're now going to contaminate that surface. So we want to make sure that they are sneezing into that, contain the sneeze, and again, contain the respiratory droplets which actually spread the flu.
Colleen, one of the things that I think is important to understand is about the virus themselves, or what do they require to live for their sustained life for any length of time outside of the body of a host organism?
Okay, certainly, because we're dealing with a virus here. A virus cannot grow and reproduce outside of its host cell. It can live for a short time on environmental surfaces. If you have a warm, moist environment, it can live potentially up to 24 to 48 hours. But again, the transmission from that environment to the person is very low. That's not a very efficient means of transmission. Certainly, as Chad said, disinfectant with regular household cleaners will take care of it. The virus is very easy to kill. So it's not a hard thing to kill. We just need to be diligent about the hand hygiene and the environmental cleaning.
So the practices that are built into the plan become very, very important, keeping this in mind.
That's right.
Yeah, we're going to go back to Cadman once again, because actually this is a good story in this fabrication that we have created for the purposes of our demonstrated training today. We want to go back to Cadman once more, look at a company that recognized the need to plan for a kind of emergency that we are showcasing here today. They thought it might affect their business because for them, many lives in the community were already in their hands.
There were some businesses here in South County who really were ready for the pandemic. It's not surprising that these companies were largely in fields like home health care. Cadmill Home Health Agency was a good example. Planning for the worst is one of the things that this agency is very proud of, since the care of others is in their hands.
Louise Jackson is the supervisor at Cadmill Home Health.
Cadmill Home Health Agency serves patients in their homes, and we cover a variety of healthcare issues such as wound management, disease control, health maintenance, and also some education, probably a few other healthcare issues as well.
Have you been checking your own blood pressure daily?
No, I haven't. At Cadmill, we serve anybody who needs our services. However, most of our clients are the elderly.
Get tight on your arm, but it'll release quickly.
A crisis like this is something that we considered a long time ago. A part of our mission at Cadmill is that we believe that we should be an example of preparedness in the community. So we sat down with our staff, through a few staff meetings, created a plan. One component of that plan was that we needed to give our staff some cross-training, so that if one employee is absent for a period of time, that we have another one that can step in and fill that role. A second component was that we have a do not come into the office sick policy. If you wake up in the morning, you are not feeling well, do not come to the office and infect other people. That way it allows our sick employee to stay at home and get better, and it also allows us who are healthy to continue to serve the community and our clients. A third component of the plan was that we allow our staff to work from home. We can give them a couple of weeks of supplies, they can serve their own clients from their home, and if they need more supplies, we can drop them off in the mailbox, we keep in touch by phone, but it allows us not to have one central location which could possibly serve as an incubator for the flu. The pandemic affected our agency first through our patients. We began to see that our patients were becoming flu victims. So that made us decide that we needed to do something with our staff as well. We instituted very strict personal hygiene procedures, as well as general precautions such as wearing gloves and masks to make sure that our staff remained healthy. We lost a little bit of efficiency, about 5 to 10%, but we were still out there giving great quality care to our patients in a reasonably timely fashion. We have recovered extremely well from the pandemic. We are currently operating at about 98% efficiency, which means that we are seeing our patients on time almost all the time.
Obviously proving the point we're trying to make here, preparation is key in a pandemic flu. Just a few minutes left in our webcast. We want to bring back some of the guests we had earlier in this webcast. Steve Wagner, Ohio Department of Health, Mel House, and Patrick Sheehan with the Ohio Emergency Management Agency. Steve, what types of personal protective equipment are suitable for businesses that really aren't involved in healthcare, just your average business, a hardware store, mom and pop store?
For the most part, personal protective equipment, or what people are really usually thinking about, which is face masks or respirators, are really not called for in terms of that normal business operation. Certainly the type of personal protective equipment is dependent on what the virus is or what the disease is. In this case, because of the nature of influenza, it really is about healthcare workers and their protections because of their contact with direct patient care.
Bill, you want to go to some email questions? We've been asking for them all hour long. Let's
and we've got some great ones.
Yeah.
First one is from David Sullenberger, and the question is, what is the difference between H1N1 and H5N1?
So I'll start first with saying what the similarity is. They're both influenza viruses, and we see different types of influenza virus throughout the time period. H5N1 was a type of influenza that we had not have yet to see being something that spreads efficiently between people. It has never materialized that way 2 years ago, and still we're concerned that it could make that jump and become an efficient spreader from person to person. But what we have seen is that this new virus, H1N1, has become a very efficient spreader person to person.
It's very interesting how these different viruses will behave and impact.